Right now, look at your fingernails. Not your nails in general. Look closely. Are any of them unusually pale? Almost white near the base? Has any nail started curving downward at the tip, almost like a little dome? Do you have any thin horizontal grooves running across one or more nails? Are any nails spoon-shaped, dipping inward instead of lying flat? Have any of your nails turned a dull, persistent yellow, with no fungal infection to explain it? If you noticed even one of those things just now, this video was made for you. Because those are not cosmetic issues. They are not aging. They are not just dry nails. According to published clinical research and medical literature reviewed by neurologists, dermatologists, and internal medicine specialists, specific changes in the shape, color, and texture of your nails are among the earliest visible indicators that 5 serious diseases may already be developing inside your body. Diseases that, in most cases, produce no other obvious symptoms in their early stages. Your nails are growing from living tissue. They are supplied by blood vessels. They are connected to your nervous system. They're influenced by every organ in your body. When something goes wrong internally, your nails often change before you feel sick. Today, we go through all 5, one by one. What the nail change looks like, what disease it may signal, what the science says, and exactly when it becomes something to act on. Stay through all 5, because sign number 3 is the one most people dismiss as aging, and it is connected to 2 of the most serious diseases in senior medicine. Welcome. This channel is built on one commitment: taking real, published medical research and delivering it in plain language, so that adults over 50 have the information their health actually deserves. No products, no scare tactics, just evidence, honestly explained. If this is your first time here, hit subscribe. We do this every week. And if someone you care about is over 50, share this video. What you are about to learn could help them catch something early enough to make a real difference. Let's get into it. Before we go through the 5 diseases, you need to understand one thing. Why nails? Why would something happening in your liver or your lungs or your kidneys show up in your fingernails? The answer is biology. Your nails are not dead material. They're living structures, grown continuously from a tissue called the nail matrix, located just under the base of each nail. That matrix is constantly dividing and producing new nail cells. To do that, it needs a consistent supply of oxygen, nutrients, and signals from the blood. Every nail on your hand is connected directly to your circulatory system through tiny blood vessels in the nail bed. The pink color you see through a healthy nail, that is blood, visible through translucent nail tissue. When circulation is compromised, when oxygen levels in the blood drop, when a liver is struggling to process proteins, when the kidneys can no longer filter waste properly, those changes arrive at the nail bed through the bloodstream. The nail responds. Its color changes. Its shape changes. Its growth rate changes. Grooves form. Curves appear. Research published in peer-reviewed medical literature has confirmed this for decades. A 2023 study in the journal Dermatology Research and Therapy confirmed that 52 to 82% of patients with chronic kidney disease show measurable nail changes. Nail changes in systemic diseases have been documented across cardiology, nephrology, pulmonology, and endocrinology literature. The American Academy of Family Physicians published a landmark clinical review specifically titled Nail Abnormalities: Clues to Systemic Disease, confirming that nail changes are legitimate diagnostic indicators that should be investigated, not dismissed. Your nails are not decoration. They are a window, and here's what to look for. Sign number 1, white nails, Terry's nails, liver disease, heart failure, and diabetes. The first sign is one of the most documented in clinical medicine and one of the least recognized by the public. Look at your nails right now. A healthy nail is mostly pink because the blood vessels in the nail bed show through. But if you notice that most of the nail appears white or pale, almost like frosted glass, with only a narrow band of pink or reddish-brown at the very tip, that pattern has a clinical name: Terry's nails, named after Dr. Richard Terry, who first identified and described this finding. In his original published research, Terry discovered that this specific appearance, the white nail with a narrow distal band, appeared in the majority of patients with advanced liver disease. Here is the mechanism. In healthy nails, blood flow through the tiny vessels of the nail bed gives the nail its pink color. In Terry's nails, those vessels become compressed, partially crowded out by an increase in connective tissue growth within the nail bed. Less visible blood flow means a paler, whiter nail. And what drives that connective tissue proliferation? Research links it most consistently to 3 conditions. The first, liver disease, particularly cirrhosis. A multi-center study of patients with cirrhosis found that 25.6% of them had Terry's nails. That is more than 1 in 4. The liver is responsible for producing albumin, the main protein in your blood. When the liver fails to produce enough albumin, the nail bed tissue changes, and the nails turn white. The second, congestive heart failure. When the heart cannot pump efficiently, circulation to the extremities, including the fingertips, becomes compromised. The nail bed response mirrors what is seen in liver disease. The third, type 2 diabetes. Research published in PMC journals confirmed that Terry's nails are associated with adult-onset diabetes mellitus, alongside peripheral vascular disease. Here is what makes this sign particularly important after 50. All 3 of those conditions, liver disease, heart failure, and diabetes, are frequently silent in their early to middle stages. No dramatic symptoms, just a body quietly struggling, while the nails show the earliest visible evidence. What to do? Look at your nails in natural light. If the pink-to-white ratio is reversed, meaning more white than pink, and that persists over several weeks, that is worth bringing to a healthcare provider. A liver function panel, an echocardiogram, and a fasting blood glucose test are all simple, accessible tests that can evaluate these 3 possibilities quickly. Sign number 2, club nails, lung disease, heart disease, and low blood oxygen. The second sign develops slowly, so slowly that most people do not notice it until someone points it out. Clubbing. Here is how to check yourself right now. Hold up your index fingers with the nails facing each other, tips touching. Look at the small diamond-shaped gap that naturally forms between the nails and the first knuckles. That gap should be visible in a person with healthy nails. If that gap has disappeared, if the nail tips touch each other completely, with no space visible, that is a positive result for what clinicians call Shamroth's window test, a well-documented screening method for nail clubbing. Clubbing means that the soft tissue at the fingertip has gradually enlarged. The nail has begun curving downward, wrapping around the swollen fingertip. The nail angle, the angle between the nail plate and the finger, increases beyond normal. Cleveland Clinic describes this as one of the most clinically significant nail findings in medicine. And the primary reason it develops is this: chronically low oxygen levels in the blood. When the tissues of your body are not receiving adequate oxygen over a sustained period, the fingertips respond by increasing blood flow. New blood vessels grow. The tissue expands. The nail curves. Published research confirms that lung diseases are the most common causes, particularly COPD, pulmonary fibrosis, lung cancer, and bronchiectasis. A clinical study published in PMC confirmed that patients with interstitial lung disease who had clubbing had measurably lower blood oxygen levels and significantly reduced pulmonary function compared to those without clubbing. But lung disease is not the only cause. Congenital heart disease and certain forms of cardiovascular disease, conditions that reduce the oxygen-carrying efficiency of the circulation, also produce clubbing. The American Academy of Family Physicians notes that clubbing without an obvious associated disease should prompt investigation for bronchogenic carcinoma, meaning lung cancer, or another occult systemic cause. Here is the critical clinical reality. COPD affects an estimated 16 million diagnosed Americans, and research suggests millions more are undiagnosed. Lung cancer, when detected early, has significantly better treatment outcomes than when detected late. And clubbing can appear before breathing difficulty becomes obvious. If you check the Shamroth window test and find the gap is partially or completely absent, and you smoke or have smoked, and you're over 50, That is a combination that warrants a chest X-ray and pulmonary function evaluation. Not in 3 months. Soon. Sign number 3. Horizontal grooves, Bose-Lyons heart attack, diabetes, and kidney failure. This is the sign most people look at and think, oh, I must have bumped my finger. Bose-Lyons. They are horizontal grooves, indentations, running straight across the nail from one side to the other. Not a scratch. Not a ridge that runs the length of the nail. A dip, a clear groove going across the nail. And they're one of the most medically significant things your nail can show. Here is the biology of what creates them. Your nails grow continuously from the nail matrix, that living growth tissue at the base of the nail. Under normal conditions, the matrix divides steadily, producing new nail cells at a constant rate. When the body experiences a severe internal stress, a major illness, a significant metabolic disruption, nail matrix activity temporarily stops. Growth halts. When it resumes, the nail that forms at the restart point is thinner than normal. As that thinner section grows outward over the following weeks, it appears as a visible groove across the nail. Bose-Lyons are essentially a timeline, a recorded history of trauma inside your body. Published research in PMC journals confirms the conditions associated with Bose-Lyons include coronary thrombosis, heart attack, uncontrolled diabetes, kidney failure, severe infections involving high fever, peripheral artery disease, and significant metabolic disruptions. A 2024 systematic review also confirmed Bose-Lyons as documented indicators of prior severe COVID-19 infection, demonstrating how sensitive this nail response actually is to systemic stress events. Here is the critical implication. If you see Bose-Lyons on your nails right now, and you cannot connect them to a known illness, surgery, or major physical stress from recent months, those grooves represent a physiological event that you may not have been aware of. Something significant enough to halt nail growth happened. And if you do not know what it was, that is worth finding out. The Mayo Clinic explicitly lists Bose-Lyons as a nail problem not to ignore, specifically linking them to diabetes that is not well controlled in conditions involving narrowed blood vessels reducing circulation. If you find Bose-Lyons, especially across multiple nails simultaneously, write down when you first noticed them, because a clinician can actually estimate when the event occurred based on where the groove sits on the nail. Nails grow approximately 3 millimeters per month. The distance from the cuticle to the groove gives a timeline. Sign number 4, spoon-shaped nails, koilonychia, iron deficiency anemia, and heart stress. The fourth sign is one of the most visually distinctive and one of the most overlooked. Spoon nails. The technical term is koilonychia, and you can check for it right now. Look at your fingernails from a side. A normal nail curves gently downward at the tip. Now, look at the surface of the nail. Does it curve inward, like a shallow bowl or a spoon? If you placed a small drop of water on a nail, would it stay pooled in the center instead of rolling off? If yes, that is koilonychia, and its most common cause, confirmed by Mayo Clinic, the American Academy of Family Physicians, and multiple published clinical studies, is iron deficiency anemia. Here is why iron deficiency produces this specific nail change. Iron is essential for the production of hemoglobin, the protein inside red blood cells that carries oxygen throughout the body. When iron levels drop too low, red blood cell production is impaired. The body cannot deliver adequate oxygen to its tissues. And the nail matrix, which requires consistent oxygen and nutrients to grow properly, produces structurally weaker, thinner nail cells that eventually lose their normal curve and invert. But iron deficiency anemia is not just a tired and pale condition. Research confirms that iron deficiency, even without full anemia, places significant stress on the heart. The heart must pump harder and faster to deliver the same amount of oxygen that it would normally deliver with healthier blood. Research from Live Hospital confirms that people with iron deficiency anemia are at measurably higher risk of developing coronary artery disease and heart failure over time. The heart sustains a chronic workload elevation that, over years, contributes to structural changes and increased cardiovascular risk. Additionally, koilonychia is associated with hemochromatosis, a condition where the body absorbs too much iron, causing iron to accumulate in organs including the liver, heart, and pancreas. This condition is significantly underdiagnosed and carries serious organ damage risk if untreated. The practical action step. If your nails show a consistent spoon shape across multiple fingers, not just one nail from an old injury, a simple blood test measuring serum ferritin and hemoglobin can tell you within days whether iron deficiency or iron overload is present. Both conditions are treatable. Both conditions, left unaddressed, carry compounding long-term risks. Sign number 5, persistent yellow nails, thyroid disease, lung disease, and diabetes. The 5th sign is the one most people completely dismiss. Yellow nails. Because the immediate assumption is always fungal infection. And sometimes that is exactly what it is. A single nail, thickened, yellowing at the edge, with a slightly powdery texture beneath. That is typical onychomycosis, fungal nail infection, and it is extremely common. But that is not the yellow we are talking about. We are talking about multiple nails, all of them taking on a dull, yellowish tinge. Nails that have grown slowly. Nails that may have slightly thickened but have no obvious fungal pattern. And critically, no successful response to antifungal treatment. University hospitals' published research confirms that yellow nails affecting multiple nails simultaneously can indicate thyroid conditions. Both hypothyroidism and hyperthyroidism, liver disease, congestive heart failure, lung disease, and type 2 diabetes. The thyroid connection is particularly important after 50. Hypothyroidism, an underactive thyroid, affects an estimated 5% of Americans over 60, with studies suggesting the undiagnosed rate may be even higher among seniors. The thyroid regulates the metabolic rate of virtually every cell in the body. When thyroid output drops, nail growth slows dramatically. Nails become brittle. They thicken. They turn a dusky yellow. And because hypothyroidism's other symptoms, fatigue, weight gain, feeling cold, cognitive slowness, so closely mimic normal aging, it goes undetected for years. The lung disease connection operates through a different mechanism. In yellow nail syndrome, a recognized clinical entity documented in the American family physician literature, yellowing of all nails occurs alongside slow nail growth and lymphedema. This syndrome is associated with pleural effusion, fluid accumulation in the lungs, and chronic respiratory conditions. What to do? Yellow nails across multiple fingers, persisting for more than a month, with no clear fungal explanation and no response to antifungal treatment, warrant a blood test including thyroid function panel, liver function panel, and fasting glucose. This is one blood draw that can screen for 3 serious conditions simultaneously. You have now seen all 5. Let me give you a clear, simple framework to take away from this video. First, do the check today. Look at all 10 fingernails in natural light. Check for whiteness, curving, grooves, inward cupping, and persistent yellowing. You're looking for patterns, changes that affect multiple nails, not just one. Second, know the 4 that need prompt attention. Club nails with a missing shamroth window gap, especially if you smoke. Bow's lines across multiple nails with no known illness to explain them. Terry's nails, mostly white with a narrow distal band. Yellow nails across multiple fingers with no response to antifungal treatment. These 4 warrant evaluation within weeks, not months. Third, bring documentation. Take a clear photo of your nails today. In natural light. No filter. If you're seeing something unusual, that photo becomes important context for a healthcare provider at your next appointment. Fourth, the blood tests that answer most of these questions are simple. Complete blood count. Serum ferritin, liver function panel, kidney function panel, thyroid function panel, fasting blood glucose. These are routine tests. Most can be ordered in a single visit, and together they can screen for every disease we discussed today. Your body has never stopped communicating with you. Every day, it leaves evidence. Small signals, visible signs, biological messages that most of us were never taught to read. The nails you have been trimming every 2 weeks, they have been keeping a record of your oxygen levels. your liver function, your heart's workload, your metabolic health. That record has been there all along. Now, you know how to read it. Early detection is not just a phrase. Research consistently shows that virtually every disease we discuss today, liver disease, heart failure, lung disease, kidney disease, thyroid dysfunction, responds dramatically better to treatment when caught in its earlier stages. The check takes 30 seconds. The information it gives you is priceless. If this video gave you something valuable today, a new habit, a new awareness, something worth sharing, please subscribe. Every week, we go this deep on the research that matters most for adults over 50. And leave a comment below. Which of these 5 signs have you noticed? In yourself or someone you care about? Your comment might be the exact thing someone else needs to read before their next appointment. Take care of yourselves. See you in the next one.